Fainting can happen suddenly. Stay calm and act. One moment someone looks fine, the next they collapse without warning. Panic often takes over, but your actions in the first 60 seconds can make the difference between quick recovery and danger. Fainting, or syncope, is usually caused by a sudden drop in blood flow to the brain. While many episodes are brief and harmless, they can sometimes signal a more serious condition. That's why your response must be fast, clear, and effective. In this video, we'll cover the exact steps: laying the person down, elevating their legs, checking breathing, and knowing when to call for help. We'll also reveal a common mistake that could put them at greater risk. Step 1. Lay the person down. The first action is simple but critical. Lay the person flat on their back. Never try to sit them up immediately. This can cause blood to rush away from the brain again, triggering another collapse. Laying them flat helps restore circulation and gives the brain oxygen it desperately needs. Quickly check the area for hazards like sharp furniture edges and move them if possible. Loosen tight clothing around the neck or waist to ease breathing. This single step lays the foundation for recovery and buys precious seconds while you prepare for the next life-saving actions. Step 2. Elevate the legs. Once the person is safely lying flat, the next critical step is to elevate their legs about 12 to 18 inches above heart level. You can use a pillow, folded jacket, or even your hands if nothing else is available. This position, known as the shock position, encourages blood to flow back toward the brain, speeding up recovery. Fainting often occurs because of a sudden drop in blood pressure or reduced circulation to the brain, so lifting the legs helps counter this imbalance. But be careful. Don't force the position if there's a risk of injury, like a fall or trauma. Elevation is about gentle assistance, not strain. Done correctly, this simple move can help the person regain consciousness more quickly, preventing another fainting episode. Step 3. Check breathing. After positioning and elevating the legs, shift your focus to one of the most vital checks: breathing. Watch the chest for movement, listen for airflow, and feel for breath on your cheek. Normal breathing usually means the fainting episode is passing and the person will recover soon. If their breathing is irregular, shallow, or stops altogether, this is a medical emergency and CPR may be required. Always stay close and keep observing, even if they regain consciousness quickly. Sometimes fainting is triggered by something minor, but other times it signals heart rhythm issues, dehydration, or low blood sugar. Continuous monitoring helps you catch danger signs early. Think of this step as standing guard between safety and crisis. The faster you notice trouble, the faster help can arrive. Step 4. Seek help if prolonged. Most fainting spells last less than a minute, and recovery is fairly quick. But if the person does not regain consciousness within a couple of minutes, or if they faint repeatedly, it's time to seek emergency help immediately. Prolonged unconsciousness can signal something far more serious, like a heart problem, neurological condition, or internal bleeding. Even if the person wakes up but still feels weak, dizzy, or confused, don't ignore it. Medical evaluation is essential. Call for professional help and keep monitoring their breathing and pulse until responders arrive. Acting fast ensures you don't miss a hidden danger. Remember, fainting itself might look harmless, but when it lingers, it's often the body's way of warning you about something critical beneath the surface. Common mistake: leaving the person alone. One of the most dangerous mistakes during a fainting episode is leaving the person unattended. Even if they seem fine, fainting can recur without warning. Imagine them waking up disoriented, trying to stand too quickly, and collapsing again, this time with the risk of serious injury from a fall. Staying with the individual ensures you can monitor their breathing, pulse, and overall condition. It also allows you to act immediately if symptoms worsen or if they slip back into unconsciousness. Never assume they'll be okay on their own. A fainting spell may be brief, but its aftermath can be unpredictable. Your presence provides both safety and reassurance until their fully stable or professional help arrives. Fainting may last only moments, but how you respond can shape the outcome. Laying the person down, elevating their legs, checking their breathing, and staying with them until help arrives are simple steps that prevent complications. Avoid the mistake of leaving them alone. Support and observation are vital. Staying calm, acting fast, and knowing what not to do transforms a frightening situation into one that's manageable and safe. Knowledge isn't just power, it's protection. If you found this guide helpful, take a moment to like this video and share it with others. Your knowledge could save a life. Don't forget to subscribe for more health and safety tips, and let us know in the comments if you've ever faced a fainting emergency.